with clear heart. Thank you. Thank you.
Thank you very much, ma'am. Very rightly said, most of the harassment cases are not being reported, maybe due to the social stigma or the mindset of the people. I would like to request Dr. Richa Gupta, ma'am, Head of the Department of Forensic Medicine and Toxicology, to kindly felicitate our guest speaker, Lieutenant Dr. Rita Nigam, ma'am. A huge round of applause. Thank you, ma'am. I would now like to request our next speaker, Dr. Madhu Nayak, Assistant Professor, Department of Pediatrics, to kindly share your knowledge on medical examination and care of child abuse victim. A huge round of applause.
Thank you, Dr. Richa, for providing me this opportunity to speak on this platform. I will be speaking on the medical examination and the care of a child abuse victim. Now, as Dr. Richa has already told that there are many kinds of abuse, and we know that among them the sexual abuse which we are focusing on today, that is the child sexual abuse, it is more common than childhood cancer, juvenile diabetes and congenital heart disease combined. So this, Dr. Richa has already told you about the statistics that nearly 53% of the children in our country, they have been sexually abused at one point of time or other, including girls and boys. And the ratio in girls and boys is almost equal. So even the young boys, they are not safe from sexual abuse. Now, this has been already discussed by Dr. Richa. What are the different types of abuse, which are mainly of main four types: neglect, physical abuse, psychological abuse, and sexual abuse. And since today's main focus is on POXO Act, I would be discussing, mainly my discussion will be on the child sexual abuse and the examination of the CSA victim. Now, a significant amount of child abuse cases are frequently missed by the healthcare providers. And for the diagnosis of this abuse to be made, there needs to be a high index of suspicion. Now, it is very unfortunate that in our country, in spite of this medical training, when we interview the doctors, they feel very unconfident, underconfident in examining abuse victims, be it a female abuse, sexual abuse victim or a child abuse victim. So they don't think that they are competent enough to do this type of examination, even after the training that they get during their MBBS years. So in developed countries like US and other European countries, there are there are subspecialties in which they are trained. The pediatrician is trained specifically for examining a child abuse victim. There are dedicated nurses which they call as SANE, that is the sexually nurses who examine the children who are sexually abused. So they have dedicated doctors, dedicated nurses who are dedicated to the examination, history taking and investigation and preparing the report of these children. But in our country, unfortunately, what happens is that whenever a child abuse victim is brought, he is usually taken to the district hospital where to the district of the child to which the child belongs. And it is the duty of the doctor who is present in the district hospital to do the medical as well as the medico-legal examination, for which they may not find themselves competent enough. Now the high index of suspicion, what are the things that can lead to us to high index of suspicion? So there is one scenario when the police has brought the child, or the parents are themselves reporting directly to the doctor for regarding abuse. But in other scenarios, sometimes a child may present to the doctor with other complaints. These may be physical complaints or certain mental complaints. What are the common physical complaints in which you should suspect abuse? Like complaints like severe abdominal pain, burning micturition, repeated frequent history of burning micturition in a young child, sexual dysfunction, menstrual disorders, repeated UTIs, mutilation of the genitalia, and unwanted pregnancy in teenage girls, miscarriage of an existing fetus, exposure to sexually transmitted diseases. Now there are certain infections like chlamydia, trichomonas, etc., which beyond the neonatal period are very highly suggestive of sexual abuse in a child, because beyond neonatal period they are not possible to be present in a child. So any infection which is sexually transmitted infection beyond the neonatal period, if it is present in a young child and the child is presenting to you with vaginal discharge or urethral discharge or difficulty in sitting or difficulty in walking even, so you should suspect abuse in this child very strongly. There are certain psychological health consequences also for which the parents may seek attention, and which are the red signs for the doctor to suspect abuse in the child. And these signs will be discussed in detail by Dr. Vishal. So I am not going to in detail of these psychological symptoms. Now, what is the role of the health provider? The role of the health provider comes in recognizing the signs and symptoms that indicate abuse or neglect. Many times what happens that the doctor, that examining doctor, he may suspect that this child is being abused, and these symptoms, they are not explainable by any other kind of injury in this child, but even then he may choose not to report this. Why? Because he may or she may try, she don't want to go into the repeated court proceedings. So many times the doctor, they will not report the case even when they suspect it highly, so which is wrong. Now, obtaining a medical history of the child's experience in a facilitating, non-judgmental and empathetic manner. Now this is very important. For example, some of you backbenchers, you are constantly laughing in such a sensitive topic. So this is exactly what a child abuse victim faces. What happens? The child, when he is disclosing, first of all, it is a very bold step for the child to make a disclosure, okay? But when the child is disclosing, the pediatrician or the treating doctor may not take him seriously, or he may express disgust, he may express displeasure, or he may express a very shocking type of reaction. So all those reactions should be avoided. You should express a very balanced degrey of concern when a child has disclosed to you. Your first reaction should be that you should express your concern, and you should say, okay, I am happy that you chose me to disclose your problem, and I will do whatever I can do to help you. So this should be the first response of the doctor to which the child has disclosed. So you should be very empathetic to the child. You should not make fun of the child in any way. Why? Because if this first experience, अगर बच्चा आपको सबसे पहले आपसे contact में बता रहा है, if he is disclosing to you, what will happen? He will get this type of reaction. He will withdraw, and now he will not be disclosing to anyone else, because he will think that ऐसे ही मेरे साथ सब करने वाले हैं. Nobody is going to take me seriously. So it is a duty, first and foremost duty of the doctor, to be very understanding, to be very friendly, to be very empathetic with the child, and to approach the child in a very concerned way without expressing any overdue degree of shock or dismissal. Now, assessing and addressing the safety of the child is another very important issue that the doctor should take into account. What does this line mean? Assessing the safety of the child. Sometimes what happens that the parent, the father, or the who has brought the child to you himself is the abuser. So in that case, what will happen, that you have to decide whether to admit this child or whether to involve the child welfare agencies, so that the child, because you know that after disclosure, if the child is going to go back to home, he may suffer further abuse. So it is very important that you should assess the safety of the child. This assessment should be done by the examining doctor. Now, interacting responsibly with the caregivers in suspected cases of child maltreatment, providing immediate medical and psychosocial support for children who are exposed to physical, sexual and emotional violence, collecting the medical history, conducting physical exams, and appropriate documentation of findings and recommendations for treatment. This is something in which we doctors are very lacking and very poor. Our documentation is not good. So you should remember that in any medical legal case, the documentation is the backbone, okay? And the case, whether it is going to stand in the court or not, will depend on how well you have documented your exam history and your examination findings. So you should take this documentation very seriously, and forms are now standardized, forms are given, provided by the government to document this and record the case of your examination and history part, and you should use those standardized forms. Obtaining photographic and video documentation of all diagnostic findings that appear and testifying in court when required. So these are all the roles of the health professional which are expected. Now the guiding principles is that you should always think of the best interest of the child and adolescent. For example, if the girl has been brought to you with bleeding, excessive bleeding per vaginum, so you cannot say that पहले इसका FIR कराइए और इसके बाद मैं इसको treat करूँगा. That has been completely, you will be this is a criminal offense. So you have to treat the child first, irrespective of whether the FIR has been made or not. And this is the best interest of the child, is that you should give him or her the immediate medical care that he or she requires. So protect and promote the safety of the child, provide sensitive care. Again, this part is very important. The child, he has already, his trust has been broken by someone. Most of the cases of child abuse are done by someone who the child trusts, who the child already knows. Okay. So now you will be if you are not sensitive to the child, what will happen? You will become another adult who is being insensitive to him, and the child will completely lose faith in the system, and he may not disclose any further. So you should be very sensitive to the child. You should protect and promote privacy and confidentiality. The principle, you should take into account the age of the child. Some children are very young, 2 years, 3 years, 5 years. So all the children are not going to disclose in the same way. Sometimes you have to think about the developmental level of the child while taking the history and performing an examination. Now you should provide information to the child that is appropriate to his age, and seek informed consent and respect the autonomy of the child. For respecting autonomy includes that you should not, if the child is refusing examination, you cannot force the child to examine him. Okay, you should document that refusal, and this is for child who are more than 12 years of age. We will discuss this further. So another guiding principles are the principle of non-discrimination. So the child can be male or a female, he can be from any caste, from any socioeconomic status. You have to treat all the children in the same way. And then the principle of participation. So these are the guiding principles as per the WHO. Now what are the guidelines for the healthcare professional? क्योंकि हमारे पास जब भी ऐसा कोई बच्चा आता है, हमारे कई बार हाथ पैर ठंडे हो जाते हैं कि अब क्या करें. Especially the new doctors who pass out and they join the district hospitals, they don't know what to do with this child. So first important step is, first of all, assess the safety of the child, and if the child requires any urgent management, that needs to be done first. So initial resuscitation and first aid should be your first priority, rather than taking history. So example, if the child is bleeding from any side, your first priority is to control that bleeding rather than taking history or filing, asking the parent to go and contact the police. Okay, so informed consent for examination. After you have done the first aid of the child, the second is, before doing anything, you should take an informed consent. Now for children who are more than 12 years of age, the consent should be taken from the child. And for smaller children, the consent has to be taken from the parents. Now in India, what happens is that the legal consent is considered to be given only when the child is more than 18 years of age. So in between the child who is between 12 to 18 years of age, we call it as an assent. So in that assent, if the child has given you assent, it should be again, that can be given by the child only for medical examination and not for any invasive procedure. So if you want to do some invasive procedure in that child, that consent cannot be said that you have taken that consent from a 12 to 18 years old child. The consent can be taken only, any procedural consent can be given by a child only if he is more than 18 years of age. So 12 to 18 years के बीच के बच्चे में आपको बच्चे से भी consent लेना है, और अगर आप कोई procedure करने जा रहे हैं, तो you have to take the consent of his or her parent also. And in all the children who are less than 12 years of age, the consent has to be taken from the parent. Now this consent taking is very important. It should be well documented and preserved. Now detailed history taking is the next part, then come to medical examination, and age estimation in some cases is may be required in cases of the children who are orphan, who have undergone some institutional abuse, or in sometimes sometimes the children who are stray children who are brought to you by the police, and they may ask for age estimation. In that case you have to do the age estimation as well. Now what are the caution? It is important to realize that physical examination in child sexual abuse is very likely to be within normal limits in most cases. So in many studies it has been seen that in almost 90% of children the physical examination will be normal in 90 to 95% of cases. You will not find any sign of abuse either anogenital area or any other part of the body. And why this happens? Because the perpetrator is very often known to the child and the family, and the use of physical force is rarely a major component in child sexual abuse. Disclosure of abuse is often delayed for weeks or months, and by that time any physical evidence may be absent. So mostly what happens, there may be a single episode in a pre-teen or teenager girl of single act of assault, but in most children what we see is that the same known person of the child is repeating the abuse again and again over a long period of time, and you know the child doesn't even may not even have the maturity to understand what is actually happening with him, or is anything wrong is happening with him. And sometimes even if the child is understanding the situation, he may be threatened by the abuser, okay, and the abuser, they play mentally with the child. They may threat the child that they should not disclose it to anyone, or they may say, they may instill a feeling of guilt in the child. So all these circumstances go into this, and that's why what happens that when the child is reporting to you, or when the parents are finally bringing the child to you, that it has already been a long time since the abuse, since the last abuse may have taken place. So you may not get any physical findings of assault on physical examination. Even then, in all cases of abuse, you should aim to do a good physical examination. Now you may ask why it is necessary if in 90 to 95% of cases we are not going to get any signs. Why it is important to do the examination? The examination has dual purpose. The most important thing is that it will reassure the child as well as the parent that the child is normal, and he doesn't suffer from any injury because of the bad experience that he has gone through, and this is very reassuring for the family as well as for the child. So that's why the physical examination, even if you suspect that you are not going to find anything, it is very important part. Why? Because the reassurance of the child that he is physically normal, his genital area is normal, and there is nothing wrong with his body even after abuse that has taken place. So it is reassuring. Now that these are the components of a comprehensive health care. So first of all, you are going to take consent, followed by first aid, then you will take the history, do the examination, and if you are required, the evidence collection may be done by the forensic team, or sometimes in the district levels it may be done by the examining doctor himself. And then you will the examination में आपको age estimation भी करना पड़ सकता है if it is required by the police, and evidence collection has to be done and it has to be handed over to the police. In treatment, you will have to give any required treatment if you feel it is required, and then you can discharge the patient. And if you feel that the child requires a follow-up for medical reasons, you should ask the child to come for follow-up. Now treatment of injuries like sexually transmitted infections, test and prophylaxis, HIV test and prophylaxis, emergency contraception, ये सब आता है treatment में, and we will discuss it further. Now consent we have already talked about. Now history. Now history is very important. As I have already told you, first you have to document the consent. Second, you have to be very friendly, empathetic, and sensitive to the child. And you should assure him that you are not going to disclose this against his will to any other person. But if the child and the family refuses to file an FIR, you have to disclose this thing to the child and the family that you are supposed to inform to the police, even if they don't want to file an FIR. So you will make this case as an MLC. Even if they are not filing an FIR, you will file a medico-legal case in this case. So you have in the history, you will ask the last occurrence of alleged abuse. Why? Because अगर बहुत दिन पहले हुआ है तो अभी आपको कोई भी finding नहीं मिलेगी examination में, and that is why you can justify, because that the abuse has taken place a long back, and so we are not finding anything on examination. Now, first time the alleged abuse occurred, the many children, they may not remember even when was the first time in cases of repeated assault. Threats अगर कोई दिए गए हों तो you should ask about those threats. What was the nature of the assault? Anal, vaginal, oral penetration, or just fondling? So the child may not know the site of penetration, but may be able to indicate by pointing. So you know, very young children, they even do not know the name of the genital organs. Okay, because sex education is such a taboo in our society. So it is very difficult sometimes to use proper words, to ask proper questions, because the child doesn't understand what you are asking him. So you can just ask him to show which part of the body was touched, so he can point with his finger. So depending upon the maturity and the developmental level of the child, you will have to, you know, tailor your interview with the child. Whether or not the child noticed any injuries or complained of pain, especially in the anogenital region. The child may have difficulty in urination, pain during urination, pain during defecation. All those complaints should be properly elicited. Vaginal, anal pain, bleeding, discharge following the event, and any pain or difficulty while voiding or defecating, urinary or fetal incontinence. You can use illustrative books or body charts, or a doll can be used, is available to show the body part where it hurts. Okay. So if you don't find yourself competent enough to take the history from a child, you should call an expert. You should always call an expert. Vaccination history is also important with regards to tetanus or diphtheria, tetanus, DPT vaccine, and hepatitis B vaccine, as to ascertain if prophylaxis is required. Okay. So you should also take the history of urethral, vaginal discharge, warts, ulcers, burning, lower abdominal pain. If there is discharge, you should record the texture, color, and odor of the discharge, and relevant surgical history in relation to the treatment of fissures, injuries, scars of anogenital area should be noted. So this part will be a multidisciplinary part. You may have to involve the gynecologist. You may have involved to the surgeon if there is a perineal laceration हो सकता है बच्चे में, vaginal tears हो सकते हैं. For all those things, this will be a multidisciplinary thing. And for mental component, you will have to involve the psychiatrist. So this CSA is not the examination of the child abuse victim, and the further management is not the area in which a single doctor is going to fill all the blanks. You have to involve a multidisciplinary team, and which will involve not only the pediatrician and the gynecologist, but also the forensic examiner for taking up good history, a pediatric surgeon for surgical problems, and also your even a radiologist and psychiatrist may be required. Now coming to the examination. So in the examination, record if the survivor is oriented in time, place, and person. In cases of teenager girls, sometimes in a case of single sexual assault, they may have been drugged, or alcohol may be given to the girl. So you should always see whether the child is oriented or not when she is brought to you, and whether she is able to respond to all the questions asked by the doctor. Any signs of intoxication by ingestion or injection of drug or alcohol must be noted, and definitely all the vitals are important. You should note all the vitals for the sake of the completion, and sometimes you will get important clues by noting the vitals. Now examination, record the height and weight of the child. Note any bruise, burns, scars or rashes on the skin, nail abrasions, teeth bite marks, cuts, lacerations, fracture, tenderness, any other injury. Carefully describe the size, site, location, shape, color, signs of healing, dimensions of any injury that you find on the body of the child. Check for any signs that force or restraints were used, particularly around the neck and in the extremity. So you may find ligation marks near the neck, you may find some rope marks on the wrist of the child. So all these should be noted. And a body image diagram is provided in the forensic history examination thing. There you have to mark all the injuries, number them, and then on those numbers you will have to describe each and every injury in great detail. All these things have to be noted. Now record the child's sexual developmental stage. For this we do Tanner staging. आपको ये देखना है कि बच्चा प्री प्यूबर्टल है मेडिकली कि प्यूबर्टल बच्चा है, and record whether the survival was menstruating at the time of assault or examination. In the case of pubertal girl childs, it is very important because during menstruation you may not be able to do a thorough physical examination, and you will have to call the child after the menstruation has stopped. for further examination. So second examination is required on a later date in order to record the injuries clearly. The same applies to, you should also take the history ki assault ke baad female, especially jo female teenager girls hain, whether they took a bath, they defecated or urinated, and any use of spermicide after the assault. All these points should be noted very diligently. Now after the general examination of the skin, you will go for the local examination of the genitalia, which we call as the orogenital examination and the anogenital examination. So per speculum examination is not a must in the case of children or young girls when there is no history of penetration and no visible injuries. So nowadays, per speculum examination is not at all done. If it is only done if there is severe bleeding from vagina or there is some evidence of tear or vaginal bleeding or perineal tear, and that in the case of children that is done under general anesthesia. Okay, so it is very important that you understand. And the per vaginal examination, जिसको हम layman language में 2 finger test कहते हैं, वो completely obsolete हो गया है, उसका कोई role नहीं है और आपको ये बिल्कुल भी नहीं करना है. ठीक है, even in the pubertal girls, even in the adult females, this test has become totally obsolete, and you should not use this test for determining whether sexual assault has been done or not. I was reading Times of India one time, and इसमें लिखा हुआ था कि a very sincere police officer, she was a female, she convinced one child and her family to file a case under POXO Act, and they were very much motivated by the female officer, and they did this thing. But what happened during the medical examination, the lady gynecologist, she did the 2 finger test on the female, which was as traumatizing as the actual assault for the child. So what happened? She was a 13 years old child. So the family and the child, they completely became incooperative. They said that this is so painful, and you promised us so many things, but from the start itself it is so painful and so insensitive towards us. So they withdraw the case. They didn't approach further. So that is the difference. If you do a proper medical examination, if you are doing a proper medical examination, the child should trust you, and this will make his case strong. So examination of the vulva for any signs of recent injury like bleeding, tears, bruises, abrasions. If the vaginal discharge is there, note the texture, color and odor. See for any stains or warts, and oral cavity should also be examined for any evidence of bleeding, discharge, tear, edema or tenderness. Now these are the findings. I am not going to go into the detail because they are done by usually some experts. But one important thing, that the shape of the hymen has no relation with the sexual activity of the child, because in a normal hymen has so many different shapes and so many different normal variations, that if you don't have expertise, you cannot understand that whether this is normal or whether this is due to sexual assault. So interpretation of the hymen should be left to an expert. If you are not trained in it, you cannot comment whether the hymen is broken or not, or whether this is due to sexual assault or not. So interpretation of hymen, many normal variants are present, and so you should be very careful. And nowadays size of the condition of the hymen or the perforation of the hymen is not given much weightage in sexual assault cases, because hymen may be broken even in the pubertal and prepubertal girls due to a number of reasons. For example, it may be due to some fall, some cycling. Cycling can also cause a hymenal rupture. So it is not given that much weightage as it was previously given. Now certain conditions that may be mistaken for abuse, this is a differential diagnosis, are urethral prolapse, vulval ulcer, some failure of midline fusion, also called perineal groove. So this will come only with experience, how to differentiate these findings are normal or whether these are abnormal findings. But there are certain findings which are very highly suggestive of sexual assault. For example, infections which are transmitted by sexual contact, like genital, rectal or pharyngeal gonorrheal infection, syphilis, chlamydia, trichomonas, HIV if transmission by blood transfusion has been ruled out. ऐसा कोई भी infection अगर बच्चे में मिलता है beyond neonatal period, then it is very highly suggestive that sexual assault has taken place in this child. And what is diagnostic of sexual assault contact in a female child? Pregnancy, or semen if it is identified in the forensic specimen which is taken directly from the child's body. Now there are certain injuries which are indicative of acute or healed trauma to the genital or anal tissues, like bruising, petechiae or abrasions, acute laceration of the hymen and of any depth, which may be partial or complete, vaginal lacerations, perineal lacerations with exposure of tissue below the dermis, and a defect in the posterior half of the hymen which is wider than the transection with an absence of hymenal tissue extending to the base of the hymen. So these are certain findings which are highly suggestive of assault in a female victim. Similarly, in male victims, you may find perineal tear also, you may find bruises on the penis, you may find bite marks around the genital area, or even lacerations may be there. So all those things must be documented properly. These are the various positions. Again, there are many more positions, but these are the common positions that you should have knowledge while you are examining the child. Again, the age of the child has to be taken into consideration. A younger child, the most suitable place to do the examination is on the mother's lap, because obviously once you try to put the table on the child on the table, what will happen? The child will start immediately crying. So you should examine a younger infant on the mother's lap, but an older child, you should take the child into your confidence, and you should tell him how you are going to, all the steps should be explained to the child properly. आप यहाँ पे जब wards में आते हो तब भी आप बच्चों को कैसे treat करते हो, even the adult patients, how you treat them. आप गए bedside और patient का कपड़ा उठाया और examine करने लगे. Is this the way that you should examine? No, na? Similarly, many students I have seen that they go to the wards, they take a case, and while they are talking to the parents, they will just start examining the child even without talking to the child. So, child से भी आपको बात करना है. You cannot take him for granted. The child has his own will. You should ask the permission of the child before examining the child. You should explain what you are going to do with him. And this is very important to earn the trust of the child. And this also will tell on what principles as a doctor you are following. Okay, so it is very important to talk to the child, to explain all the procedure to the child beforehand, and whether it will be painful, because बच्चे को सबसे ज़्यादा डर किससे लगता है कि हो सकता है फिर से pain होगा. It is said that the medical examination should be not be a second assault for the child, isn't it? एक assault से तो बच्चा हो के आया है, फिर आपने medical exam ऐसा किया कि उसमें बच्चे को फिर assaulted feel हुआ. So you will lose that thing. Okay, so you should be very gentle. Most of the findings will be seen on observation itself. आपको observation पे ही बहुत सारी findings मिल जाएंगी. As I have already told, बहुत कम बच्चों में आपको बहुत severe lesions बहुत कम बच्चों में देखने को मिलते हैं. Most of the 90 to 99% of the findings will be seen on observation itself. And in cases where invasive procedures like per speculum examination is required, it will be done under GA only. And so you will explain the child that I am just going to see only. And there are certain positions which will assist your findings, like this supine frog leg position, which is A. The B position is the chest, classical knee chest position for anal examination. The third position again for anal examination with traction of the buttocks. This is for again anal examination of the child. And the fourth examination is in the female child with, this is known as labial traction, and the fifth position thing is labial separation. So just observing, you are not inserting your fingers, you are not inserting any instrument inside the child, just the positions that you need to know for examining the child. These are the common positions. In male children, usually the knee chest position and the lateral decubitus position is helpful. Now, what are the investigations which are required? If the bone age estimation is required, you will go for x-rays of the elbow, of the knee, of the wrist, and also of the hip joint for the estimation of the bone age. For any suspected fracture, injury, appropriate investigation of the relevant part of the body should be done. Urine pregnancy test should be done in all the pubertal girls and by the doctor on duty, and the report should be entered in your record. The blood should be corrected for the baseline HIV status, VDRL status, and hepatitis B status. And at the same time, you should take history of immunization in this child. बच्चे को hepatitis B vaccine लगा है कि नहीं, ये आपको इसी instant पे पूछ लेना है. Collection of samples for forensic science laboratory. If the survivor is reporting within 96 hours of assault, then it is very important that ये इसको हम emergency examination बोलते हैं. और अगर बच्चा 4 दिन के बाद आ रहा है आपके पास, then this is not, it is a non-urgent or non-emergency examination, क्योंकि अब आपको पता है you are not going to find any forensic specimens from this child. So सारे specimens अगर within 96 hours आता है, especially within the first 72 hours of assault, तभी आपको कुछ significant sperm या semen के specimen मिल सकते हैं बच्चे में. So if the survivor is reporting within 96 hours of the assault, the evidence including oral swabs, vaginal swabs, anal swabs, vulval swabs, all should be taken 2 wet swab should be used for this purpose. और एक पूरी किट आती है जिसको हम सेफ किट बोलते हैं, सेक्सुअल असॉल्ट फोरेंसिक एविडेंस किट. तो उस किट में ये सारी चीजें होती हैं, उसमें से आपको ये स्वैब्स लेने हैं. स्वैब्स आर यूज्ड टू कलेक्ट ब्लड स्टेन्स ऑन द बॉडी, foreign material on the body surfaces, seminal stains on the skin surface, and other stains. Clothes that the survivor was wearing at the time of the incident. You know, especially in prepubertal children, the clothes are very important, or even the bed sheet or the blanket that the child had used is very important. Because most of the times what will happen, you will not find the evidence on the body of the child, but on the cloth and on the bed sheet of the child. So it is very important. अगर 96 hours के अंदर बच्चा आपको पास आ रहा है, so you should collect the clothes of the child that he was wearing during the time of assault. Always ensure that the clothes and samples are air dried before storing them in their respective packets. क्योंकि हमने सब कुछ सैम्पलिंग तो कर ली, लेकिन हमने उसको प्रिजर्व ठीक से नहीं किया. अगेन ऑल आपका जो है एविडेंस कलेक्शन सब बेकार जाएगा. ओके, हेयर एंड फॉरेन मटेरियल आपको मिल सकता है. यू शुड कीप दम प्रॉपरली इन डेजिग्नेटेड पैकेट्स एंड लेबल दम प्रॉपरली. ब्लड ग्रुपिंग इज वेरी इंपॉर्टेंट. विक्टिम का आपको ब्लड ग्रुपिंग करना है. एट द सेम टाइम सम केसेस में आपको ये देखना पड़ सकता है कि विक्टिम को ड्रग तो नहीं किया गया था या अल्कोहल तो नहीं दिया गया था. सो फॉर दोज टेस्ट ऑल्सो यू मे रिक्वायर द ब्लड ऑफ द चाइल्ड. If a person has come directly to the hospital without the police requisition, the hospital is bound to provide the treatment and conduct a medical examination with consent of the survivor, parent or guardian. A police requisition is not required for this. These are the caveats which I am discussing. We have already talked about the examination. Survivors of sexual violence should receive all services completely free of cost. ये provision है आपके POCSO Act में कि जितनी भी services हैं वो आपको free of cost देनी है. चाहे वो history taking examination है, जितने भी investigations हैं, x-rays है, urine pregnancy test है, any medications which you are going to give to this child, all should be provided by the hospital free of cost. A copy of all documentation must be provided to the survivor free of cost. ये भी आपकी ड्यूटी है कि जो भी आपने उसका फाइल बनाई है, डॉक्यूमेंट्स बनाए हैं, a copy should be given to that. आपको बिना मांगे देना है इसको. That is your legal obligation to the child. The survivor, or in the case of child, the parent whom the child reposes trust, has the right to refuse a medico-legal examination or collection of evidence or both. But the refusal will not be used to deny treatment to the survivor after sexual violence. तो हो सकता है कि वो refuse कर दे medical examination के लिए, but still ये आपको उनको बताना है कि even if you refuse, we will give treatment. Treatment will not be refused to you. As per the law, the doctor is required to inform the police about the sexual offense. However, if the survivor does not wish to participate in the police investigation, it should not result in denial of treatment of sexual violence. Emphasize that seeking treatment is critical for survivors' well-being. And ये आपका जो fourth point है, अगर बच्चा या उसकी फैमिली मना कर रही है आप पुलिस इन्वेस्टिगेशन करने से, एट द टाइम ऑफ एमएलसी इंटीमेशन यू शुड सेंड टू द पुलिस अ क्लियर नोट स्टेटिंग इन्फॉर्म्ड रेफ्यूजल फॉर पुलिस इंटीमेशन. ये आपको डॉक्यूमेंट करना पड़ेगा दैट दिस इज एन इन्फॉर्म्ड रेफ्यूजल बाय द फैमिली फॉर इन्वॉल्विंग द पुलिस. Only in situations where it is life threatening, the doctor may initiate treatment without consent as per section 92 of IPC. So then you are supposed to write your provisional clinical opinion, which should be soundly based on the history that you have taken from the child in child's own words, and you should base it on your findings and not your opinion, which is something that is suiting you. So, okay. So this is the provisional opinion must in brief mention relevant aspects of the history of sexual violence. An inference must be drawn, and it should always be kept in mind that normal examination findings neither refute or nor confirm abuse. So this is your provisional report. It will look like something this. The genital injury is present, physical injury is present, opinion. There are signs which are suggestive of recent use of force or forceful penetration of vaginal, anus, etc. Sexual violence cannot be ruled out. रैशनल आपने क्या दिया और वाई क्यों आपने दिया, क्योंकि आपका अभी फोरेंसिक साइंस लैब की रिपोर्ट अवेटेड है. दिस इज हाउ यू विल गिव योर प्रोविजनल रिपोर्ट. और आपकी फाइनल रिपोर्ट तब बनती है जब आपका फोरेंसिक लैब का रिपोर्ट आ जाता है. दिस इज हाउ यू विल राइट योर फाइनल रिपोर्ट. नाउ व्हाट इज द ट्रीटमेंट और द केयर दैट यू विल प्रोवाइड टू दिस चाइल्ड? Very important is post-exposure prophylaxis for HIV, given if a survival reports within 72 hours of the assault. But before giving post-exposure prophylaxis, HIV risk should be assessed, and for this you will have to refer the child for ART to the ART center. Now, pregnancy prophylaxis or emergency contraception needs to be given to a girl who is Tanner stage 3 or pubertal girls. Okay, again this can be given only if the child has come to you within 72 hours of assault, and for this 2 tablets of levonorgestrel 750 microgram can be given within 72 hours, or Mala D2 tablets can be given stat repeated 12 hours later, again in the same dose. Now pregnancy assessment should be done on follow-up also. Okay, advice to get tested for pregnancy in case she misses her next period, and this is very important. Otherwise क्या होगा अगर pregnancy हो जाती है, again there will be different issues और बाद में जाके MTP के लिए आपको उसको counsel करना पड़ेगा. She may opt for that, so you should always be careful. सेक्सुअली ट्रांसमिटेड इन्फेक्शंस के लिए आपको असेस करना है. यूजुअली बच्चों में सेक्सुअल कॉन्टैक्ट के बाद सेक्सुअली ट्रांसमिटेड इन्फेक्शंस का रिस्क बहुत कम होता है, ओनली 1 to 2%. बट इवन देन इफ द चाइल्ड हु हैज बीन अ विक्टिम ऑफ मल्टीपल सेक्सुअल अब्यूज, he may present to you with urethral or vaginal discharge, then in those cases you will have to send samples, cultures for chlamydia, trichomonas, etc. to rule out the STDs, and again you will treat the child depending upon the results which are coming. For non-pregnant women, in adult girls, in girls who are more pubertal girls, you can give STD prophylaxis in the form of azithromycin or doxycycline along with metronidazole. Again hepatitis B का आपको लेना है. अगर बच्चा immunized नहीं है, this is the time you will give hepatitis B immunization. अगर जो इसने assault किया है, he is a known case of HIV positive, he is a known hepatitis B positive person. In that case आपका vaccination से काम नहीं चलेगा. In that case you will have to give hepatitis B immunoglobulin immediately within 72 hours after the sexual act. So these are the important medical things. Any laceration हो सकते हैं, जैसे कि we have, depending upon the degree, you will have to refer the child for surgical management of the lacerations and tears. एंड अगेन इंपॉर्टेंट, अगर आपकी हिस्ट्री में आपको पता चलता है कि बच्चे को डीटी या डीपीटी या टीटी वैक्सीन नहीं लगा है, डिपेंडिंग अपॉन द एज, यू विल एडवाइज दैट वैक्सीनेशन टू दिस चाइल्ड इमीडिएटली. नाउ फॉलो अप में अगेन, अगर आपको लगा कि इस टाइम कोई एसटीडी आपने डिटेक्ट किया है, तो यू विल गिव द ट्रीटमेंट एंड देन यू विल आस्क द चाइल्ड टू कम बैक फॉर फॉलो अप to rule out the STDs subsequently. Now psychosocial care will be discussed by Dr. Vishal. And thank you for your patient listening. And a few inputs that I would like to give on the POCSO Act, that the act in itself is very good. But one thing which is very lagging is that when the patient comes, the child or the family comes to the hospital, he has to go to different departments. He will come to the, maybe pediatrician, then the pediatrician will refer him to the gynecologist, then the gynecologist will assess the degree of tear. Usko pata chala bahut zyada tear hai, she will refer them to pediatric surgery. Then there will be a referral to psychiatrist. So we don't want this, because again this, you are assaulting the child in other way. So it should be suggested to the government that a single platform should be made where all the services, the child should come there, and all the facilities should be given then and there to the child there itself. So इस टाइप का प्रोविजन अगर बन जाए तो बहुत अच्छा है. एंड मैम आपसे एक और रिक्वेस्ट है कि these persons who are actually made, जिनको आपने वो किया, मतलब जो फाइंड गए हैं असॉल्ट, जो अब्यूजर्स हैं, there should be some registry of those abusers. So because and there should be some portal where you can see, आप चेक कर सकते हो कि ये अब्यूसर्स है. क्योंकि स्कूल में जो टीचर्स आते हैं, हमारे घर में जो मेड्स आते हैं, वी डोंट नो हाउ टू नो अबाउट वेदर दे आर सेफ और नॉट. सो देयर शुड बी, जैसे कि वेस्टर्न कंट्रीज में होता है, देयर इज अ पोर्टल वेयर यू कैन सी, आप देख सकते हो पर्सन की हिस्ट्री, वेदर ही इज अ offender already or not. He will go into that list, you will find कि this person is an abuser. तो ऐसी कोई पोर्टल बनाना चाहिए, कोई एंट्री बनानी चाहिए जिसमें आपके अब्यूसर्स का लिस्ट हो, ऑनलाइन अवेलेबल हो.